Language therapy, often referred to as speech-language therapy or speech-language pathology, is a specialized field aimed at diagnosing and treating communication disorders. Here's a breakdown of its key components. Need for language therapy. 1. Language disorders can affect individuals of all ages and can manifest in various ways, such as difficulty with speech production, understanding language, forming sentences, or using language appropriately in social contexts. 2. The need for language therapy arises when these difficulties significantly impact an individual's ability to communicate effectively, participate in social interactions, engage in academic or vocational tasks, or perform daily activities. Assessment. 1. Assessment is the first step in language therapy and involves a comprehensive evaluation of the individual's communication skills, including speech, language, cognition, and social communication. 2. Assessment tools may include standardized tests, observation, interviews with the individual and their caregivers, and collaboration with other professionals, such as educators or healthcare providers. 3. The assessment helps identify the specific nature and severity of the language disorder, as well as any underlying factors contributing to the communication difficulties. Scope of language therapy. 1. Language therapy addresses a wide range of communication disorders, including but not limited to articulation disorders, difficulty with speech sound production, language disorders, difficulty with understanding and/or using language, fluency disorders, disruptions in the flow of speech, such as stuttering, voice disorders, abnormalities in pitch, volume, or quality of voice, pragmatic language disorders, difficulty with social communication skills, such as turn-taking, maintaining topics, and understanding nonverbal cues. 2. The scope of language therapy extends beyond addressing the immediate communication difficulties to include improving overall communication competence, enhancing social interactions, and promoting functional communication in various contexts. Nature of intervention. 1. Language therapy interventions are tailored to the specific needs of the individual based on the assessment findings. 2. Interventions may include speech drills and exercises to target specific speech sounds or language structures, language stimulation activities to improve vocabulary, grammar, and comprehension, social skills training to facilitate appropriate communication in social settings, augmentative and alternative communication (AAC) strategies for individuals who have limited verbal communication abilities, counseling and support for individuals and their families to address emotional and psychological aspects related to communication difficulties. 3. Intervention approaches may vary in intensity, frequency, and duration based on the severity of the language disorder and the individual's progress. 4. Therapy sessions are often conducted by licensed speech-language pathologists or therapists who have specialized training in communication disorders. Overall, language therapy aims to improve communication skills, enhance quality of life, and promote independence for individuals with communication disorders. It involves a collaborative effort among the individual, their family members, educators, and healthcare professionals to achieve optimal outcomes.